little bit of hospital administrator Lillian Posadas' time. Lillian, we saw the record for COVID-19 hospitalizations. I think it was set. Well, it was set again yesterday, and then it was broke again with the very next announcement of the COVID-19 census at GMH. So, if we could, good morning, by the way, and get right into the numbers at Guam Memorial Hospital with the administrator Lillian Posadas. Good morning, Lillian.
Good morning. Good morning, Chris. Good morning, Sabrina. Good morning, Guam. Yes, our census this morning is at 78. Yesterday we had 83 yesterday in the morning, and so we've had some discharges. We've had some transfers over to the SIF. So this morning it's at 78. Of the 78, 14 of them are at the ICU level of care, and of the 14, 4 are on ventilators, and 11 at the SIF. We have transferred a total of about 51 COVID individuals to the SIF. Most of them have gone home, and some of them have gone to the ISOFAC. So, there's progress there. There is hope, and that people have, healed and recovered from this condition. And as far as the, ventilator, the program that Dr. Oven launched in terms of a really active and robust proning approach of these individuals, and that the goal is to prevent them from their respiratory system, further deteriorating, and that they don't need to be on a ventilator. So it seems to be working very well for individuals on ventilator. Sorry about that.
It's okay. Lillian, I wanted to ask about, because, I'd seen some different messages in my WhatsApp chat groups about equipment and things being moved over to the Guam Memorial Hospital. Do you have any information on anything, I don't know, tents or anything being constructed or
Constructed?
Or not constructed, but are you guys doing anything over at GMH? I'm just wondering because, like I said, I heard that there was heavy equipment and people moving stuff over to GMH. Is anything going on?
Oh, always going on. Lots of things always going on. We've moved the pediatrics. Actually, it's going to be at 10 o'clock. We're going to start moving those patients in the pediatrics to the 4th floor. We're moving them down to the 1st floor rehab area. That has been converted. The whole area has been converted to accommodate pediatric patients. And if they need to be on a pediatric intensive care unit level, we've also made that area available for the peds population. And in terms of construction that you're talking about, we had the DPW clear out and put some, asphalt, gravel in this courtyard area closest to the Z-wing. The purpose of that is to put a tent that will be used by the Guam Fire Department for their donning and their doffing process. We are going to be getting BlueMed tents. I understand they've arrived on island and they're going through the process, the customs clearance process. We are going to be getting BlueMed tents to replace the Warrior tent that's in front of the emergency room. And we're going to station it wherein it will be, under the overhang, so that if we need to, those are for COVID overflow patients who come in through ER. If they need to then come in and be admitted, the overhang will prevent the rain or the patient from getting caught in the rain. So that's what we're going to be doing, is stationing that BlueMed tent there. Then the other BlueMed tent that we're going to station is in the right in the area where the physician's parking lot is, and it's covered. It's going to be protected because it's kind of like an underground parking, but it's open. It's an open bay, and so it will have some protection. If in the event we have typhoon, that BlueMed tent, we're going to use it for overflow of Care 3 patients, COVID patients, who are then either ready to be discharged home or transferred over to the SIF. So that's what's going on in terms of our, continuous, ongoing restructuring, converting our units, our areas, to accommodate patients. And I mentioned last time also that we have used now the volunteers gift shop. We've moved some of the rehab team into there so that they can continue providing rehab therapy services for inpatients who are non-COVID. You know, they need to have their rehab therapy, so they will be coming down to either the first floor, or the team will need to go out to where the non-COVID patients are at who need ongoing rehab therapy. The other part of the rehab team, we've got them stationed over at the CIV so that they can provide, again, ongoing and continuous rehab therapy, treatments and activities for the COVID patients who are there at the CIV, so that they can continue the proning and whatever other, physical therapy or rehab therapy to make sure that, they continue to progress in their recovery.
Right.
So those are what's going on.
Lillian, we saw the pictures of the hospital beds out in the, parking lot, and you're just telling us that we're putting people in the gift shop. What about these tents?
Yeah, I wanted to follow up on the
Yeah.
tents, the BlueMed tents. You said that we're
Which
gonna.
one?
Do they really exist? Because I feel like they must not exist if we're not using them.
No, the BlueMed tents that are waiting to be cleared by customs, right? That's what Dr. Cabrera told us yesterday.
That's what I just said. Yeah, one will be stationed in the front of the emergency room.
Okay.
The other one will be down in the physician parking lot.
Lillian, though, what kind of, we're looking at a storm passing south of Guam this weekend. How strong are these tents?
Well, my understanding is that they are not capable of withholding typhoon winds, and that's why we're putting them under an enclosed area in the physician so that there's that protection. And also in the emergency room, we're putting them under the overhang, so there's a little bit of protection there. But if anything, if we need to take it down, then for the safety of the patients and the staff, if we need to take it down, then we need to take it down. If we can secure it down more, those are options that we need to take into consideration. Yeah.
Can I follow up on what you were talking about with the pediatrics being moved to the first floor? So the fourth floor then, is that, I've lost count, is this like a CARES 5, CARES 6 unit, and what's the bed capacity?
Okay, the fourth floor right now, that's our surgical floor.
Okay.
We have about, I believe, 33 or 35 beds in that area. So when we move the pediatrics down, that will give us the whole surgical floor available for non-COVID, because that floor is still non-COVID. Surgical patients that we house, and so that will give us the capability of more adult beds for non-surgical, non-COVID.
You guys met last night, the Guam Memorial Hospital Board of Trustees. There was a part, I think, in some of the discussion that some of the nurses were split to go from or go to GRMC to help. But then I heard there was a portion where it was mentioned that there's some nurses calling out. They don't want to come in. Can you tell me about that?
No, it's not that they don't want to come in. They're getting sick. They're working a lot of hours. So they're tired, they're getting sick. And so both the GMH nursing staff and some of the staffing solutions staff who are here, they're getting tired and they're getting sick. So that's why there's all that call-ins. And, when they do call in, we adjust again the schedule to make sure we cover the areas.
Lillian, when you say they're getting sick, you don't mean sick with a capital S, right? You mean they're not COVID, they're just overworked?
They're just, they're tired, they're overworked. A few have, have tested positive, but majority of them have been cleared and have come back to work. So, they're just tired, they're burned out, they've worked many hours, and so they just need to take a break. And,
Do you guys still have that facility? I remember we talked about it. I don't know if it was condos or hotel or something where GMH staff can go and stay.
The medical staff lodging?
Right,
Yes,
yeah.
we have that available still, and, we've been given the extension to the end of December. So that, yes, that is available, and it is being fully occupied by our medical staff.
Could you talk about Regeneron?
Regeneron is a monoclonal antibody. We haven't yet started using it, but we received communication from HHS and asking if we would like to be on the list for shipment. And we say yes, we want to, because it's a treatment that hopefully will prevent individuals who test positive from their symptoms getting worse and from them coming into the hospital. It's also given to individuals who do not meet the criteria for the remdesivir. So, we're on the list. Hopefully we will get shipment of the Regeneron.
How much Regeneron, are they offering, and when would we anticipate it to arrive?
We don't know. That information we don't know at all. So again, we're just waiting for additional communication from our ASPR HHS support team.
And so Regeneron is basically the medication that was given to the
Is that
president.
the one that's made with the baby embryo or something?
It was given to President Trump, is what I understand.
Yeah.
All right.
Yeah.
Stem
It's the
cell or
cocktail
something.
that he got.
Yeah.
Yeah.
Thank you, Lillian. Anything else we didn't ask that we forgot that we need to know? When you talked about additional staff testing positive for the virus, is that an update from the last time you told us?
Any staff with total right now with the second wave, total number of staff who tested positive is 76. Majority of them have been cleared to come back to work.
Wow.
Before we
Yes.
do let you go, I know during the meeting, it was mentioned by one of the board members about, we always hear about everything going on with COVID, but there is some good news out of GMH, and this was with respect to a recognition, I think, an acknowledgement from the AGA.
Yes. Our citizen-centric report, that's a required report by law, that upon completing the financial audit, we are to put out, I believe within 60 days or 90 days, a citizen-centric report, just so you know, I guess a lot of information in terms of the financial status of the hospital, the CMS certification that we continue to, maintain, the total number of individuals or patients that were treated during that fiscal year of the audit. And so it's just a lot of information. And if you want a copy, we can send you a copy. But the association, Accountant Association, recognized GMH for its, citizen-centric report, being very informative, very comprehensive, and, just very helpful information.
Right.
So we thank the AGA for recognizing GMH. And that was put together by Rodolin Gerardo, who was our chief auditor, and also the acting CFO, Ms. Yuka Genova. So they
Right.
did a great job with that.
Lillian, just to kind of add to that recognition that you received, we have a special presentation for you as well. If you look behind you there in the KUAM News Zoom room, there's a couple platters of sweet spaghetti with hot dogs.
Oh, gosh. Well, thank you, but I prefer the mac and cheese, the lobster mac and cheese.
Okay, we'll make another
And
batch.
we can make it happen, okay? Okay.
Thanks, Lillian.
Thank you, Lillian. Be
Take care
safe.
and stay
Okay.
safe.
Okay.
Jay, dog, your sweet spaghetti, not really.
We might actually have unintended leftovers.
Yeah.
Hopefully our mayoral and vice mayoral candidates are, hungry.
Yeah, Gigo seems like they would be into